Hello everybody. In normal conference I would say in this moment, wow, but now I see only an empty auditorium with two cameramen over there. But my name is Lauri, and very shortly say here that warmly welcome to 9th European Conference on Mental Health. And without the commitment of the scientific committee, this conference would never take place. So it's my very big honor to present to you Professor Brenda Happel from Australia, who is joining us, of course, using these marvelous connections. Brenda, are you okay there in Australia?
And the stage is yours.
Thank you very much, Larry. Yes, I am fine here. Thank you very much. I'd like to start by thanking Larry and Lisa and all members of the organising committee for once again inviting me to chair the scientific committee of the European Conference on Mental Health. I think this is my fifth. And perhaps more importantly, I'd like to thank them for their commitment, resolve, flexibility and determination in making this event happen in the most challenging circumstances of our lifetimes. It's one of the very few conferences I know of that has not been cancelled completely. At a time when our personal and professional connections are reduced by physical distancing and lockdown measures, our need for connection is greater than ever. Not having the conferences we rely on to network, interact professionally, reunite with friends and make new ones further compounds our sense of isolation. On behalf of the scientific committee and conference delegates, I thank you all for taking up the challenge and making this conference happen. It's impressive to see the number of presentations at this conference and participation from 14 countries, including throughout Europe and including Australia, Canada, Iran, Israel and the US. I must say it does feel rather strange. I'm used to looking at an audience of people and hope that they'll laugh at my jokes, but instead I'm looking at Larry and Lisa, who may or may not laugh at my jokes. I don't actually have very many this year. While I'm used to using Microsoft Teams and other platforms to connect with people all over the world, I've never delivered a speech this way before, so please forgive my nerves and any mistakes I might make. At the same time, it's quite an amazing feeling to be speaking to you from the other side of the world. Physical distancing at its most extreme. But social distancing is no greater for me for once than people living in different parts of the same country. Since I first attended the second conference in Turku, I have increasingly felt connected with the colleagues I have met from all over the world. And I feel that even now, despite being amidst a global pandemic, and having thousands of kilometres between us, that I am still connected. When I left the Belfast conference last year, I was already making plans to be at Lisbon as part of a European vacation. It took me a while, firstly, to understand and then to accept that COVID-19 meant the plans I had taken for granted were not going to happen. And rather than looking forward to a holiday, I was looking forward to getting out of the house. It was nothing I had ever experienced or imagined in my lifetime. I found it shocking and painful. Not being able to connect face to face with my family and friends was very distressing, particularly since I had declared 2020 as the year to catch up with people I had not seen in a long time. The greatest pain of all was seeing the television footage of lines and lines of people queuing up to register for unemployment benefits. It made me realise how lucky I am, and to reflect on how much I take for granted in the very comfortable world I live in. Each of you here, no doubt, have stories to tell about how COVID-19 has affected you both personally and professionally, and so much attention has been given to keeping people apart. We as mental health experts know how important it is to keep people together, to maintain that sense of connection, to feel part of the lives of others and to believe that support is available when it's needed. These challenges reinforce just how important mental health expertise is at times of crisis. Understandably, the public health response has been about controlling the virus, avoiding transmission, and preparing health services for the needs of people affected by COVID. We as mental health professionals know only too well about the impact of the pandemic on people's mental health in so many ways. Fear of contracting the virus, isolation from friends and family, loneliness, unemployment, and the loss of social support networks, to name just a few. This impact has been profound and is likely to be enduring. I'm sure we all applaud the resources, time and expertise being invested across the world in finding a vaccine and appropriate treatments. Many of us dream about the days we can return to normal. What a cause for celebration that will be. People will return to work and study. They will reconnect with friends and family, go out for dinner and to the movies, and take holidays both locally and overseas. Problem solved? We all know that the mental health impacts will not disappear that easily. Some jobs will be gone forever. Some networks will be lost. The fear and pain experienced by people already vulnerable will be profound. And as the immediate physical dangers are managed, these mental health needs may well be ignored. Your work lies ahead of you. There will be much to do. I want to take this time to acknowledge the contribution each and every one of you has made and is making to enhancing the mental health of others in the COVID world and at other times. I also commend the people who are presenting their COVID research at this conference. It's so important. It's also important to remember our own mental health. You will remember the safety message on aeroplanes. Please secure your own mask before helping others. Without maintaining your own mental health, your ability to help others will be severely limited. I hope this conference provides some time and space to reflect on what you need to remain mentally healthy. Unfortunately, my participation in this conference will be limited by time zones. I'm generally quite good at staying up late when I attend the conference in person, with some assistance from jet lag. I'm not so good at it in my own home. I will certainly do my best to attend as much as I can. Unfortunately, I think the speed dating and the toast to our mental health will be past our bedtime. Possibly for the best. I have made a promise to cut down my drinking. Just joking, I would never promise that. Have a wonderful conference, everyone. Enjoy the sessions, take the opportunity to learn and network, and most of all, have fun. I hope to see you all in Lisbon next year. Thank you.
Thanks, Brenda. Thank you very much for your kind words and your input as a scientific committee chair for I don't know how many years. Thank you. And we will see you next year in Lisbon, I'm sure. Thank you very much.
Thank you. Thank you. Bye.
So, this conference is organized from Finland and beautiful city of Helsinki, the capital of Finland. And we have an honor to have a short greetings from
Deputy Mayor of Helsinki, Sanna Vesikansa. It's a recorded message, but it's wonderful that we are able to work from Helsinki and we have a good relationship with the City of Helsinki Social and Healthcare Organization. So maybe we now can hear Sanna's presentation.
Good day from the City of Helsinki. I warmly welcome you to this important conference in Helsinki. It would be so nice to see all of you face to face here in the city, but this is the time and reality we live in. This is the time of social distancing. It's a bad term. We need to keep a physical distance, but luckily technology helps us also keep us socially together. I hope this conference affirms this to all of you. We can be together even with the coronavirus. I am sure that all of you are aware of the difficult problems and difficult times we have faced, all of us in this shared world. But I hope that these difficult times also has brought us more together and realized how interlinked we are and how much more we need to work together. If you would be visiting our city, I would tell more about Helsinki, but I think I can now concentrate on certain things the examples how Helsinki is working towards better mental health. Finland has been very lucky that we have had activists in this area. I'm happy also to see many of you present in this wonderful conference. I think one of the most important subjects in this area is lessening the stigma associated with mental health problems. This work is not done, but I think we have taken many important steps. The public discussion has changed. With less stigma comes with more demand also. Many people from other places have said the same. Young people do not hide their problems. They ask for help, and they ask it in terms of mental health services. We must answer this demand. In Helsinki, we have been able to open some new services. We call them Mieppi. They are open to all or everyone over 13 years old. We believe that when we make these base level services better, this also opens up spots for more demanding services. The other important change we have seen in the last years is the use of experts by experience. They are part of our services. They help people facing their own difficulties and also help us designing better services. They also hold reception and offer appointments, and many are residents. For them, it's much easier to come to talk to a peer than for the first time than go to a doctor or other expert. This work is very useful. I think that this approach helps us also to see the things from the viewpoint of the users. It is just too easy to design services from the viewpoint of the system. I'm happy also to see that recovery orientation is the focus of your conference here. Our mental health and substance abuse services have held for a long time recovery orientation as the main principle in developing our services. I think this offers us a great opportunities for creating good services that have an impact. Helsinki is always happy to be the place for interaction and meetings. Even though you are here only digitally this time, I hope from the bottom of my heart that your meeting is productive and good. I also hope that at some point in the future you have a chance to visit our city. I hope that you have a marvelous meeting and conference. Thank you.
So welcome everyone to ECMH conference online first time. My name is Liisa Kallio, and I'm a partner in a company EviPro, which is organizing the conference together with Lauri and some other people also. I want to name Virve also from our team, who has been working hard for the conference. We have just few tips before the first keynote speak is starting, and we want to share you some tips what we have found useful when testing this platform, Hopin. So please use Chrome browser if possible. That is functioning absolutely the best. You maybe can follow the conference with other browsers also, which is okay. But if you have an active role, Chrome would be most safe choice. Please also check your cameras, microphones and speakers, and use headsets if possible.
And we have also noticed that if other programs are running at the same time on your computer, that could cause some problems. So we advise you to close all other applications and programs, especially Microsoft Teams, which can do some hassle in the system. We have noticed that in our rehearsals that usually most of the problems can be solved by refreshing the page. And this can easily be done with the F5 command. That's a good tip to remember also.
Yes. And then because we are lucky to have people from, I don't know if all continents, but about all continents also in this online conference, which was by the way, very exciting if we're gonna get, but we got. So people in early mornings and late evenings at this time also are maybe presenting the opening ceremony and the first day. Because of this, it's very, very important actually that you mute your microphone and video when you are not talking, and this is for the connection's sake.
I'm sure that most of you have already experienced remote working or studying or this online life in general. And we all know that this can be really heavy, and this can overload your thinking and your brain. So it's really important that you take breaks during the conference. We have more breaks than usually here in this online event. If you have possibility to get some fresh air during the day, do it please, and remember to drink water and have good meals also during the days.
We have also collected some material. What you find in your expo area, there will be some yoga exercises. Walking in a Finnish forest exercise might be interesting for many of you. And also we are having this social media posting context. So we recommend you to take break, go out from the room and take maybe a photo around you, what is reminding you of good mental health or symbolizing that for you. Publish them in our social media and use the hashtag ECMH 2020, and you might be awarded, because we're going to award the best posting of the conference.
Yeah, and the award is very nice. The winner of this contest will get a free entrance to next year's conference in Lisbon.
Yes.
And yeah, as we are not everybody, we are all in different places, so it would be lovely to see where you are actually participating in the conference. So the surroundings or office or your home office, or if you can be outside, that would be lovely to see also.
And as usually our conference has been, and we are very trusting that it will happen this year also, that people are staying connected. So use the chat platform in Hopin and participate all the ways what is possible. Also networking program will be there, and you can try it out today in what's that called? Get Together,
yes.
Program, which is starting 4:15 p.m. Finnish time.
Yeah, be careful with this time zones, because this can be a little bit confusing. We are running this in Finnish time because we are in Finland, but I understand that it can be complicated. What else do we need to say? Maybe something about this afternoon's program. We will have some live yoga actually here in this surrounding we are here at the moment, so please join us. There will be, maybe Lisa and I will show also some yoga.
You do?
Yes,
we do?
We do,
okay,
yes, some
we do.
yoga moves at the same time.
But there will be some others also, and a professional yoga teacher.
Yes,
true. Yes.
And if possible, we would like to, or we will propose a toast for good mental health. So we invite you all, everybody, to have a glass of your favorite drink with you, and then we can propose a toast together.
Yes, and this all starts 4:15 in a Get Together happening this afternoon, Finnish time.
Okay, I'm sure that we will face some technical challenges during the days. Be patient to yourself, be patient to your colleagues or other presenters, and there will be technical help in all the sessions, so we do the best we can in order to help everybody in making a smooth and nice online experience for you.
And before we start with the keynote, I want to thank our team. We have a wonderful voluntary workers team and the team members here on the spot to help you. They are for your help with technical issues and everything. We do our best, that we can promise. And also we want to thank already all the speakers who will be already today, some of you in the sessions.
And we have nice people from the company who are
Yes.
over there in the audience, but doing the technical things very, very well. Okay, shall we move to our first
Yes.
keynote speaker?
We do that.
As you may have noticed, one of our conference partners is Mieli Mental Health Finland, which is, if I remember correctly, the oldest mental health association in the world.
That's correct.
Yeah.
At least the oldest still functioning.
Still functioning, yeah. And we are very happy to have Meri Larivaara from Mieli Mental Health as our first keynote speaker. Warmly welcome, and the stage is yours.
Thank you, Lauri, and thank you, Lisa. So, hello everybody. It certainly feels a little bit strange to be talking to you without seeing any of you there, but I trust you are still there and listening, and perhaps you will be able to participate in the conversation or send some comments at least in the chat box. Anyway, I will be talking about promoting mental health in the middle of the COVID-19 pandemic, and I will use Finland as a case study, as obviously I know best what happened in Finland and how we have promoted mental health in Finland during this difficult year. And as Lauri said, I work at Mieli Mental Health Finland. I am a senior advisor there. My professional background is in medicine and cultural anthropology. So I'm a medical doctor and a specialist in public health, but I am also a cultural anthropologist. And Mieli Mental Health Finland is a relatively large NGO in the Finnish context. We have 140 employees, and we work really nationally in different parts of the country. In this slide, you should be able to see the map of Finland and our local associations as green spots around the country. And some of the spots are actually green circles showing local associations that have a crisis center that is serving clients in different kinds of life crises. Our mission is to promote mental health and to prevent mental health problems, and we defend everyone's equal right to good mental health. We also coordinate the National Crisis Center Network with local mental health associations, and we advance the mental health literacy of children, adolescents, adults, and the elderly. And major part of our funding comes from Veikkaus, which is a gaming company owned by the Finnish state with a special mission to fund activities that benefit society at large. This is a sort of a peculiar arrangement typical to Finland. Well, my presentation is divided into 5 different sections. First, I will say a couple of things about the COVID-19 epidemic in Finland, as obviously most of you won't know what kind of the situation has been here. And we are actually a country that has been rather lucky in the middle of this epidemic. Then I will talk about the impact on mental health and mental health services in Finland and how we have promoted mental health during the first wave of the epidemic. I will also propose next steps for mental health promotion in Finland, and then I will also look at the wider picture of the mental health implications of the COVID-19 epidemic and touch upon the European Union health policy. Here. Here you can see actually a picture that shows the COVID-19 positive tests taken in Finland. It starts in February, when we had very few cases, and in the beginning of the March, the numbers are suddenly rising, and they go quite a bit upwards, not compared to many other countries, but to us it seems that there are many of them. There should be around 200, well, not all of them are in the picture, so a little bit more than 200 per day in March, and then slowly going downwards towards April, May, until in the summer we were really living a rather calm period of the epidemic. And then you can see that towards the autumn we have had more and more cases, and now we are actually in a situation when the epidemic is accelerating again in Finland. What must be noted though is that in the springtime we were not able to test all people who were suffering symptoms that could be related to COVID-19 COVID-19 infection. So we have probably tested only about 20% of the positive cases in March. That's my guess. That's the best available guess probably at this point. Here you can see where we are standing now. The map of Finland looks a little bit funny in this picture, but nevertheless you can see that the epidemic is really focused on southern parts and middle parts of the Finland, while north and some eastern parts of the Finland are actually in a relatively easy situation. There are also some calm spots around the country, even when you go towards the south. And we have a little bit less than 10,000 confirmed cases of COVID-19 in Finland. This is the cumulative number. But you can also see that the epidemic really is accelerating now. And if you compare the figures, the cases and the incidence of last 14 days to the preceding 14 days, we have really doubled the cases. The cases by age group are also provided in this picture, and what is worth pointing out is that the infections were more common in the elderly population, or at least they were diagnosed in the springtime, while now it is really spreading mostly among young people in Finland. Well, what can be said about our situation in Finland? First of all, the pandemic arrived here relatively late, so we had time to prepare and learn from the experience of other countries, especially the neighboring Sweden, Norway, and Denmark. And in March, when WHO announced the pandemic, we were really in quite calm situation still. The next day, Finland recommended remote work to everybody who could shift working at home. And the next week, the government announced that the epidemic constituted a state of emergency in Finland. And then we had the state of emergency for 3 months until the government estimated that the epidemic can be managed using the regular power of public authorities. Only 2 days after the state of emergency declaration, schools began remote education. So in Finland, we did not close our schools. We just moved to remote education that lasted for 8 weeks. And then towards the end of March, there were declared movement restrictions between Uusimaa, the southernmost part of Finland with the capital area, between that area and other parts of the country. But that, in the end, that didn't last for very long. It was only approximately 3 weeks, not even that. We have had similar restrictions as in many other countries. So you are probably well aware of what kind of restrictions come to question. What helped us survive in practice, in everyday life, is probably that it was the springtime. We were able to use nature close to our homes. We are a thinly populated country, so it was easy to go outside home, even though we need to we needed to practice social distancing. We are also a well-digitalized country, so we were able to move to shift many of our activities into remote connections. We also tend to obey authorities, and we have the Nordic welfare state model. Then also altruism emerged, and there was quite a bit of talk about mental health in Finland last spring. What we noticed in Finland is that people face the pandemic in different situations, and the pandemic had an uneven impact on the mental health of the population in Finland last spring. Some people really reported that they felt that the lockdown gave them an opportunity to slow down and spend more time at home with family members, while others experienced that it was really a remarkable increase in mental distress and symptoms. The Central Union for Child Welfare has reported that 17% of the families with children enjoyed their new everyday life during the springtime, while 44% felt that the lockdown made their life more complicated. 55,000 families with children and 100,000 children experienced scarcity of financial resources because of the pandemic. At this point, it may be worth noting that we are a small population with 5.5 million people living in the country. The schools provided remote education, as I mentioned, for 8 weeks, and the school children returned to school for 3 weeks in the end of the semester, as there was a growing worry about vulnerable children and adolescents during the remote education. Well, the level of the mental strain seems to have varied over time in Finland. We have information from media monitoring in the spring, and this reveals that there were 3 points of heightened negative feelings in the population. They were related to big news about pandemic, the first reported COVID-19 case, the pandemic declaration, this was international news of course, and then the movement restrictions of the southernmost region of Finland. But the fear was released when the public authorities were able to give clear instructions. This is actually in line with research of previous pandemics. Reliable information is important for people's mental health during these kind of times. Negative feelings and mental strain were more common among those with previous health problems, different kind of chronic conditions. Well, we also have some survey data, population survey data about the mental strain in the adult population. It has been measured by Mental Health Inventory MHI-5 questionnaire. In spring, mental strain in the adult population remained actually on the same level as it usually is, with approximately 10% experiencing significant mental strain. This is our usual level in Finland. While in mid-August, when the epidemic was really gaining force again, the share of the adult population with significant mental strain increased to 25%. But there was actually high weekly variation, which is probably related to the small sample used in the study. In spring, more than 40% of the adult population felt less hopeful about their future than usual, while in mid-August, when the epidemic was gaining more force, their share increased again to approximately half of the adult population. And it seems that the mental strain may be increasing at the moment. Statistics Finland reported in the end of August that more than 70% of Finns were worried about the risk of a loved one and almost 50% about their own risk of infection. And almost 1/3 was worried about their own financial situation or that of a loved one. My organization carried out a research in the end of August and early September, and we found out that about 27% of adult population felt that COVID-19 pandemic had influenced their mental health negatively. Young adults, women and entrepreneurs were at higher risk than other parts of the population. Well, then I will say something about what happened to our mental health services in Finland when the epidemic arrived. First, we were able to shift to remote mental health services. As I mentioned, Finland is a well-digitalized country, and this was also shown in our health services as well as in many other service sectors in the society. But still, we know that the visits to general practitioners, public health nurses, and other nurses at primary healthcare centers decreased heavily in March and April, and they have remained at lower level than usual. It seems that people are not seeking care as easily as they would otherwise. We also know that the number of appointments at maternity and child health clinics and at pupil and student welfare services have decreased. These are services that are in a relatively large role in Finland when we are thinking about mental health promotion and prevention of mental health disorders. So they are very relevant services for mental health. Also the pupil and student welfare services are very important in providing early support and identifying mental health disorders. Well, in the big picture, though, the amount of appointments at mental health and substance abuse services did not change considerably in Finland. This is due to the wide shift to remote appointments that we were able to make. But they run a risk of superficial contact and difficulties in assessing the needs of the patient. This is the estimation of the National Institute for Health and Welfare in Finland, THL. Well, the Social Insurance Institution of Finland, Kela, has reported that approximately half of psychotherapists were able to continue their clinical work without interruptions because of the remote services. And less than 5% of psychotherapists reported that most or all of their therapies were interrupted because of the pandemic. So many patients were able to continue their treatment, even though we still are in the situation where some patients may have felt that the remote connection is not equivalent to physical meeting with your psychotherapist. And so really the remote access, even though it exists, it doesn't always work. What we have also witnessed in Finland is that peer support groups and different forms of rehabilitation were closed. And sometimes, even though they were shifted to remote access, they were not so accessible or easy to reach by the people who needed them. So we have witnessed increase in the unmet need of services of people living with mental health disorders, increased loneliness and insecurity, and possible increase in the need of other types of services, while the usual services haven't been there available. Also, we know that psychiatric inpatient care was not available for some people who needed it. It was provided mainly for those who needed involuntary treatment in springtime. Then we are aware that the homeless people in Finland were especially vulnerable. I know that there are global news spreading that we don't have the homeless anymore in Finland, but that's not sadly the case. But we do still have a population of homeless people. And really, we have noticed that our social services do not have effective forms of outreach work functioning in these difficult times. We are aware of the fact that the need of mental health support may increase in the future. First of all, we know that already now the need of mental health services has increased also among those who did not need services before the pandemic. But the pandemic was such a crisis that pushed them towards the need of services. And there are a variety of things that has influenced this. There can be economic difficulties, worry about one's own health or that of a loved one, changes at work, decreased number of social contacts, the period of remote education when people were working at home and teaching their children or supporting their children in participating in the remote education, increased loneliness and social exclusion. We have estimated in Finland that the need of primary level mental health services will increase heavily as the epidemic and restrictions continue. And we are facing now the second wave. Especially people in acute crisis will need multi-sectorial support, and this may be difficult to arrange in these conditions. Well, we have also, in springtime, we have postponed beginning of non-urgent treatments. This creates increase in waiting times, and the symptoms or disorders may become more severe if not treated early enough. And then there is the fact that people at the risk of severe COVID-19 infection may not seek treatment. We believe that our primary care will be under pressure. First of all, when we are thinking of children and adolescents, we know that the pandemic has influenced especially those children and young people who have depended on networks outside home, like school, studies, hobbies, leisure time activities, different kinds of networks, who possibly have problems in their families. Perhaps the parents are not capable of supporting them as well as the children need. Child psychiatric services accepted only urgent referrals in the springtime, so we can expect that in the autumn there will be longer waiting times than usual or bigger pressure of referrals. And school and student health services will also be under pressure now that the children and young people have returned to education. and this will also influence child guidance and family counseling centers. Then we have heard that many GPs have observed in Finland that mental strain was more common among their patients, and many patients sought treatment for anxiety and various types of psychosomatic symptoms like shortness of breath or feeling pressure on one's breast and so on. And then mental strain and loneliness among people in later life has been a symptom visible to GPs in primary healthcare centers. Well, when thinking of our system at large, the sustainability of the health service system may be at risk if treatment is postponed, if cases become more difficult, and if we need to treat more complicated cases than usual, when we are not able to intervene as early as people would need. Then we are worried, of course, as many other countries, about the healthcare professionals, and we are aware that they may need psychosocial support, and in large scale, a number of healthcare professionals will need psychosocial support, especially those who have been working with COVID-19 patients, for instance, in intensive care or other wards. And actually, the Helsinki University Hospital has launched a study about this, and we have had already professional articles giving guidelines on how to deal with this. And also, Mieli Mental Health Finland has received contacts from hospitals who have asked whether we can offer crisis support to healthcare professionals who have really been stressed under the pressure of the COVID-19 epidemic. Well, there are also some positive signs. Non-governmental organizations, congregations, and different kind of voluntary activity turned out to be crucial during the lockdown, and it was able to alleviate the situation for many people. SOSTE, Finnish Federation for Social Affairs and Health, it's a federation of different kind of social and health NGOs, makes a social barometer annually, and they report. And according to the social barometer, 64% of welfare and health directors of local authorities reported that the COVID-19 pandemic launched new forms of collaboration with NGOs, and NGOs were estimated to be quick, innovative, and capable of identifying the acute needs of the population. I will now tell you an example of crisis support in Finland, which is provided by my own organization, Mieli Mental Health Finland. We provide crisis support with no referral, free of charge, and anonymously if the person wants so. And we have a variety of support and help available. There is a crisis helpline that's functioning in Finnish 24/7 every day of the year, and also other languages, but shorter hours per week. We have crisis counseling, usually face-to-face, but now it was given by remote access. And we also offer peer support groups, also given by remote access in the springtime. Then we have online crisis services, chat services for adults, and also Sekasin chat, which means messed up chat for young people in Finland, and also a gaming platform for young people with the opportunity to talk about mental health and organizing also mental health events within the gaming platform. And then we give self-help. We have developed self-help programs. And then we also have Victim Support Finland that is coordinated by our organization. What happened to our crisis helpline and Sekasin chat? The number of attempted conversations increased in both by 40% when compared to the same time period in 2019. But luckily, we were also able to strengthen our services, and the number of actual conversations was increased by 60%. But still, we were not able to help all who needed our support. The most common reasons to contact the crisis helpline are feeling bad, problems in relationships, and suicidality. But many tell how COVID-19 restrictions have complicated their everyday life and increased their experience of mental strain. For example, there is economic situation, anxiety, loneliness, lack of access to services, difficulties in deciding how to meet with elderly relatives, and so on. The most common reasons to contact the Sekasin chat for young people are very similar. There are feeling bad, problems in relationships, suicidality, but also a wish to talk about everyday life. Many of the young people are afraid of being restricted from meeting friends or getting infected at school. They are big worries that they are facing now. Well, now I thought I would tell you about how we tried to promote mental health in Finland during the first wave of the pandemic. And I would like to remind us all of the WHO definition of mental health, stating that mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So we are not really talking about mental health disorders and providing treatment and care, but we are really talking about how to promote well-being among all of us. So this is something that touches every one of us at every age. What was done in Finland, obviously, was communication, and media was really helpful in this. The mass media contacted specialists, raised the issue of mental health during the pandemic. Suddenly, mental health was much more visible for all of us in Finland. And the main topics were how the COVID pandemic and the restrictions may influence one's mental health, and how one can look after one's mental health and even promote it in these difficult conditions. Well, the other thing was that we continued remote education instead of closing schools. What we think was really mental health promotive to many students and pupils was the daily contact to teachers through remote access. Also, we offered opportunity to classroom teaching for youngest pupils and those with special needs. And then at some point, the school started also providing school meals. One could go and pick up a lunch package from the school weekly. It was organized so that we could still practice social distancing. The daily contact to the teacher was estimated to be extremely important, and one of the big worries about some students was that there were pupils and students who couldn't be reached by their teachers, who were suddenly missing for 8 weeks. Well, then our public authorities have provided information to employers about how to maintain well-being at work and how to support employees during the pandemic. Well, non-governmental organizations strengthened their support. They also started providing new types of support. And local authorities launched outreach activities, such as phone calls to people in later life, and different kinds of new forms of collaboration of civic action emerged, such as helping your neighbors in shopping groceries or in taking care of any other personal business. And then I would say that we had a variety of forms of economic support available. First of all, we have the basic structures of the Nordic welfare state that proved very useful and capable of supporting people in this kind of a crisis. Government provided support package to private businesses, and private sector initiatives also emerged, such as banks offering loan repayment holidays. Then we also had a Twitter campaign, social media campaign launched by the Prime Minister's office and the President of the Republic. But this has probably not had such a big force as it could have, as it was relatively late in terms of the spring epidemic, and also it hasn't been coordinated effectively, I would say. But we have participated in that as well in our organization. What we did as merely Mental Health Finland during the first wave is that we produced a lot of online materials for looking after one's mental health. For example, tips on how to look after one's mental health. We provided information about mental health skills and how they can support during the lockdown. We provided material for promoting mental health of children and adolescents, but also that of the people in later life. We provided information of what kind of support is available in economic difficulties. And now in the autumn time, we have also written about how one can stay mentally well during the second wave and gather one's strength once more. And then, of course, we have been able to expand remote crisis help and educate new volunteers. Well, thinking about the second step and the forthcoming years and how to promote mental health during and after the pandemic. In Finland, we were lucky. We introduced a new national mental health strategy and program for suicide prevention for 10 years in February, so just before the epidemic arrived in Finland. Our mental health strategy has 5 major areas, major topics where we want to work. And what seems remarkable to me is that we were able to write a national mental health strategy that seems to be so flexible that it seems to be useful also in the situation of COVID-19 crisis. First area of action in the mental health strategy is mental health as a capital, as a resource for life. And one of the propositions that are given in the strategies is that we should increase mental health literacy and skills in various types of everyday environments, such as early childhood education, schools, educational institutions, workplace, and services for older adults. And this is something where we had to start working quite quickly in the springtime, and it is something where we have been able to also direct financing for the forthcoming years under the umbrella of the National Mental Health Strategy. So hopefully we will be able to begin the work of increasing the mental health literacy and skills of our population. The second area of our strategy is mental health of children and young people. And the proposals there on what to do are, for example, develop mental health skills and good self-esteem in children and young people, and develop positive cultures in early education as well as primary and secondary education, actually overlapping with what I said about mental health as capital. And then also ensure sufficient available resources and coordinated collaboration for maternity and child health clinics, pupil and student welfare services, and primary health and social services for children and young people. And support children and young people under psychological strain, for example. And it seems that we are also able to direct financing there in the future years. I will skip some of my slides so that I will also be able to talk about the broader perspective. But so the next areas of National Mental Health Strategy, we have mental health rights there. And they include proposal to establish actions safeguarding rights for people with mental health or substance use disorders to participate in work and studies according to ability, and establishing operative models which increase inclusion in the workforce. And we are going to be piloting the individual placement and support model in years 2021 and 22. So this is also something concrete that we are hoping to be able to do even in the context of the pandemic. Well, the fourth area is broad-based services that meet people's needs. And we are going to begin working on strengthening the primary healthcare and primary social services in Finland and integrating these services. So we are hopeful that this will also be area will also be developing well. But what we need is improved access to psychosocial interventions and short therapy already within the primary health services. And this is really an area that's sort of uncertain at the moment in Finland. Then the fifth area is mental health management, but I will not go there in this speech now. Well, about the mental health in the first months of the pandemic, what we know internationally, I picked up a rapid review done by the Public Health Agency of Sweden in August, and that focuses in studies made in March and April in relatively high-income countries. And they witnessed the same as we did in Finland. Mental well-being decreased and mental strain increased. But also there were coping strategies that helped to relieve the stress related to the pandemic. And what we know about the previous pandemics holds here as well. So reliable and sufficient information protects people from self-reported anxiety, depression, and post-traumatic stress. Then I had a look at some other articles and I was especially fascinated by the Lancet article by Michael Marmot and colleagues that was published already in June. They state that pandemics are associated with an increased risk of developing mental disorder and poor mental well-being. Before COVID-19 pandemic, 20% of the global disease burden was attributable to mental disorder, and it is estimated that it will be higher in the future. And the effects are mediated by well-known risk factors that we are all probably familiar with. And so they propose that we are facing a triple global public mental health challenge to prevent an associated increase in mental disorders and a reduction in mental well-being across population, to protect people with a mental disorder, and to provide appropriate public mental health interventions to health professionals and carers. And they claim that we are facing an urgent need for population-scale implementation of effective public mental health interventions. And their framework is really quite familiar to all of us working in the mental health field. There are promotive things, but there are also early interventions for mental disorders and their associated effects, and then there is treatment, patient education, addressing health risk behavior, and so on. I thought towards the end I would say something about what we could do in the EU context, within the EU health policy context, in terms of the COVID-19 and mental health. We have the European Framework for Action on Mental Health and Wellbeing that was developed and published in 2016 as the work of the EU Joint Action on Mental Health and Wellbeing. It has been implemented by the member states during the past 5 years. The implementation has varied across countries, but nevertheless, it has gone forward. We also have the EU Health Programme, which is actually offering support for the implementation of best practices in the area of mental health in its annual work plan for this year, which is excellent when thinking of the situation where we are now. Then we have Council conclusions on the economy of well-being that were made in December 2019. And the Council conclusions invite the European Commission to propose a mental health strategy for the Union, taking into account the cross-sectoral impacts of different policies on mental health. And this is very important in the context of COVID-19 pandemic. We really need to work cross-sectorally. And so what I would propose when thinking about the framework, EU Health Programme and the future EU for Health Programme and the Council conclusions is that perhaps it is timely to update the European framework for the current needs, for the needs of the COVID-19 pandemic, and then to begin preparatory work for designing a long-term mental health strategy that would make the EU well prepared for future challenges similar or different from COVID-19 pandemic.
Okay, thank you very much, Meri. I've been following the chat here and I see lots of applauses, so people are clapping and thanking for your wonderful presentation.
Thank you.
Not exactly questions, but I'm sure that if we receive them, then I can send it to you and maybe you can respond also if you have possibility to join us in the chat.
Oh yes, definitely.
Yeah.
That will be possible during the forthcoming days.
Yes, wonderful. Yes. Thank you, Meri. Now we have had a good start for the conference. Now we have a small break and then we continue in the sessions. Our first oral presentation will start. Check carefully which session you would like to go and then just click the number of the session you want to participate. And for the speakers, I would like to say that go there a little bit earlier than not just when the program starts, but maybe 10 or 5 minutes earlier. Thank you very much, and now relax and enjoy and maybe have a cup of coffee or something, and see you soon in the sessions.